This presentation will provide an overview of students with emotional and behavioral disorders, or EBD. In this presentation, you will learn about the history of EBD, definitions for EBD, prevalence and causes, characteristics of students with EBD, and best practices for educating students with EBD. It wasn't until the late 1800s that it was even recognized that children experience emotional problems. Up until the mid-1900s, treatment of emotional problems in children was seen as a medical or psychological matter, not an educational matter. In the mid-1950s, behaviorists proposed that emotional or behavioral problems are learned and can be changed by teaching other more appropriate behaviors. In 1975, Public Law 94-142, or the Individuals Education for All Disabilities, All Handicapped Act, which was later named IDEA, Individuals with Disabilities Education Act. This law includes students with emotional and behavioral disorders in the category of severe emotional disturbance, meaning students can now get services in schools to be treated for emotional and behavior problems. IDEA, in 1997, IDEA changed the term severe emotional disturbance to emotionally disturbed. In 1999, the Center for Positive Behavioral Interventions and Support, or PBIS, was established by the U.S. Department of Ed to build the capacity of schools to effectively address problem behavior in positive, systematic, and differentiated ways. PBIS now is used for school-wide behavioral challenges, not just for students with EBD. There are different terms that have been used to describe EBD. So some refer to this as emotional disturbance, or ED, behavior disorders, BD. In the past, these students used to be referred to as EH, or emotionally handicapped. But for this presentation, we will use the most current term, which is EBD, emotional and behavior disorders. The definition for EBD means that one or more of the following characteristics, which I'll go over in a second, are displayed over a long period of time and to a marked degree that adversely affects educational performance. So the student would need to have one or more of the following: an ability to learn not explained by an intellectual disability, sensory disability, or health factors; an inability to build or maintain satisfactory interpersonal relationships with peers and teachers; inappropriate types of behavior or feelings under normal circumstances; a general pervasive mood of unhappiness or depression; and a tendency to develop physical symptoms or fears associated with personal or school problems. So again, a student would need to have one or more of these characteristics over a long period of time and to a marked degree, and these things must also adversely affect educational performance. If a student has some of these characteristics but is performing well academically, the student would not qualify for services under EBD. Recent statistics show that students with EBD make up 7.5% of all students receiving special education services and 0.67% of all students in schools. And as with many other disabilities, there is an increased prevalence in boys than girls. Boys are approximately 3 times more likely to have EBD than girls. There are no clear causes for EBD, but there are certainly biological factors and psychosocial factors. Biological factors include things such as genetics, brain injury, which can be caused by drug and alcohol abuse during pregnancy, or environmental toxins. It could be caused by poor nutrition, an accident, and/or an illness. Psychosocial factors include chronic stress, stressful life events, and maltreatment. Students with EBD can have a variety of characteristics, including behavioral problems, emotional problems, social difficulties, and cognitive and academic impairments. Each of these will be discussed next. As far as behavioral characteristics of students with EBD, they fall into 2 categories. Students can have internalizing behaviors, such as being withdrawn, or externalizing behaviors, which are directed towards others, and these will be explained next. Examples of internalizing behaviors include being extremely sad or depressed, feeling unworthy, being fixated on certain thoughts, frequent or sudden crying, physical symptoms, and suicidal thoughts. Examples of externalizing behaviors might include aggression, being argumentative or non-compliant, having tantrums, stealing, lying, cheating, and lack of self-control. Emotional characteristics of students with EBD can include high levels of fear and anxiety, extreme anger, low self-esteem, and depression. Students with EBD often have problems establishing and maintaining positive relationships with peers and adults due to their social skills deficits. Examples of social skills deficits that they might display include not knowing how to initiate or respond to initiations from others, not knowing how to share with others, take turns, or how to offer and receive compliments, difficulty starting, maintaining, and ending conversations, difficulty offering and receiving help, difficulty with making compromises, etc. Many students with EBD have been found to have low average to average intellectual ability. So these are not students who have cognitive impairments. However, their academic characteristics often show that they are low achievers. And so they might have a low GPA and have a high risk for dropping out of school due to this underachievement across all academic areas and their behavioral difficulties. When supporting students with EBD, it's important to use a continuum of services and supports. This is often called wraparound supports, where these students are provided with educational interventions, counseling interventions, any therapeutic or medical interventions, and that there is a continuum of support and a collaboration among all of these professionals supporting the student. It's also very important to have a preventative mindset when working with students with EBD. The most important thing we can do is try to prevent problem behaviors as opposed to react to these behaviors when they do occur. And the greatest format for using a preventative model is the use of positive behavioral interventions and supports, or PBIS. And there is a module that explains that in detail. And almost all students with EBD would need to have a functional behavior assessment to determine the reasons why their problem behaviors are occurring, and an intensive behavior intervention plan that is implemented with consistency across settings. It is also important for educators to collaborate with families and other related service providers who are supporting the student so that there is consistency of intervention across settings. Some effective teaching strategies for working with students with EBD include the use of positive reinforcement, which you can access a module on that, the use of peer-mediated interventions, and that means that we teach peer strategies to help the student function appropriately in different settings. The use of direct, explicit, systematic instruction, which there is also a module on that, and showing active engagement so that they can stay focused and positive in academic work, they would be less likely to engage in problem behaviors. Flexible scheduling, meaning we consider where problem behaviors might occur, and if there's something we could do to alter schedules to prevent these problem behaviors, we would want to think about doing that. It's often necessary to break lessons into smaller segments so the students can handle that and behave accordingly in smaller segments, as opposed to sitting engaging in long periods of instruction. We want to always accent and build upon student interest to motivate them to engage in academic activities. And we also want to increase as many opportunities as possible to allow students to make real choices. Oftentimes, kids are told what to do and how to do it, and this can result in extreme frustration. Typically, developing children will find ways to negotiate to be able to make their own decisions, but children with EBD often don't have those negotiation skills. So if they're not given enough opportunities to have real control over their environment and make choices, they'll often engage in problem behavior to get that control. So it would be preventative to provide increased opportunities for these students to have opportunities to make choices.